Okay, calling on my colleagues to confirm that you can hear me. Okay, well, let me start again and welcome you back to the 2020 Virtual Advocacy Conference. My colleagues and I at the ALS Association are very happy to welcome you. I'm going to start off with just a few housekeeping tasks. If anybody is having any difficulty hearing or seeing and you require some technical assistance, can we bring up that slide and I can point you in the right direction of who you need to check with. There are some instructionals on this slide, but you can always use the chat function to find either the ALS Association as the presenter or my colleague Selim Berhane, and by all means just chat to them using that chat feature. That's also going to be the place where you can enter your questions over the course of our webinar today. My name is Morgan Roth, and I'm the Senior Vice President of Marketing and Communications. I'll be your moderator for today's program, but I do want to turn the program over to our host, Kalanit Balas. Kalanit, as you know, is the President and CEO of the ALS Association. Kalanit, welcome.
All right. Hi there. I'll do the same as Morgan and ask my colleagues to text me to make sure that everyone can hear me. Welcome to our very first annual advocacy conference that's being held virtually. Oh, good. I can be heard. That's great. We are really excited to have so many people joining us. I see the numbers ticking up over on the right side as people from all over the country are dialing in for our first virtual conference. You're going to really get a ton of great information over the coming days. And we have a lot of special speakers that we are thrilled to bring to you as well. So I just want to thank you for joining us and hope that all that you can do to help raise awareness, to really focus on pushing forward huge policy agendas. We are so grateful for all that you do. And we recognize we've over this past few months, we keep saying ALS doesn't stop, so we can't either. And we're coming up with all different ways to make sure that our work goes forward alongside with you. So thank you for your efforts. I also want to take a moment to thank our sponsors, our gold level sponsors that make this all possible, including Alexion, Amylyx, Biogen, Genentech, Mitsubishi Tanabe Pharma America, and Pharma. Thank you all for your support and supporting the ALS community. You can find out more about their efforts by downloading the links that are being presented as handouts around this webinar. So I really want to thank you all for your support, because otherwise our work might stop, and we don't want that to happen as we go forward. And now I would like to turn the virtual microphone back over to Morgan Roth, because we have a very special guest that Morgan would like to introduce. So Morgan, the microphone and the floor is yours.
Oh, thanks, Kalanit. So I'm very, very happy to introduce you to Senator Mike Braun. Senator Braun represents Indiana in the U.S. Senate. He is a founding co-chair of the Senate ALS Caucus, created earlier this year. He's also leading efforts with other ALS champions in the Senate to secure support for passing the ALS Disability Insurance Act, which is S578. And that, as you probably know, is an act to waive the 5-month waiting period before people with ALS can access Social Security disability insurance. Welcome, Senator Braun.
We are very grateful. Can you hear me now?
Yeah.
Okay, yeah. Sorry, wasn't sure. It looks like we were on mute. The senator is walking in the door right now. Sorry for the early call. My name is Terry Seitz. I'm a staff member, and I'm going to step away, and Senator Braun will come right on in.
Hey, Senator Braun, good to be on with you. Are you able to hear me?
Yeah. Yes, we can hear you.
Thank you.
So I am ready when you are.
The floor is yours, Senator. Take it away.
Well, hey, great to be on with you today. It's a cause dear to me. I got involved with ALS Caucus, was proud to start it. Actually, it hit close to home. I had a first cousin that struggled with it and passed away just a few years ago. So I know how devastating something like that can be. I'm really eager to weigh in a way that sees some real change take place. Of course, the Als Disability Insurance Act that I've been trying hard to get across the finish line. Got 61 co-sponsors, 10 others that have committed to vote for it. So we're really at a point where we just need the floor time to be scheduled to get a vote, and I feel real good that we'll get that across the finish line. I've been interested as someone that took on healthcare reform in my own company 13 years ago, and this is from a comprehensive try to change the system that is so good at some things and so costly and sometimes not effective. Generally, you're effective and it costs too much, but sadly, our healthcare system costs us nearly twice as much as many other developed countries with outcomes that in some cases aren't as good. So I have a real interest as it would relate to Medicare, Medicaid, but mostly trying to get the healthcare system to be more affordable to all of us that depend upon it. And part of that would be to try to change a stodgy, antiquated system in my mind that focuses on what is most important. And I think that whenever you're looking at new therapeutics, just like now with COVID-19, probably we've got more opportunity to actually move on some stuff that we've been talking about for a long time. And that includes how do we get therapeutics, how do we get research items that are stuck in the system that take so long to get through, especially in the case of like ALS, where there's nothing proven and effective out there, where many people would just like to be able to expedite the process when something looks promising. And then you run into all kinds of issues where you can be part of it and then you got to pull out of it due to archaic rules and regulations. And I've got a bill called the Promising Pathway Act, which is going to do just that when it comes to drugs that are in the R&D stage, going through the 3 phases of clinical trials, to where maybe by making things more entrepreneurial, more agile, yet retaining all the guidelines of caution, that we can maybe shrink that time in half. That's a goal, and I'm going to be behind legislation. I can tell you that when you're dealing with agencies that have been around for so long, a pharmaceutical industry that has got a lot of room for improvement, to where we get the stuff through the system to where it doesn't get bogged down in government administration and to where we address the cost as well. You can see those are about 3 areas that have a lot of complications to it. So I'm anxious to keep paying attention to that. And once we get, I think, the coronavirus behind us, we had a lot of good ideas from senators across the spectrum that were playing into a couple bills that hopefully will get a little discussion. I'm not sure about floor time. I'm hoping that as well. And if not, that we get it back on a fast track after November, early into 2021. So all in all, it was an honor to be a founding member of the Als Caucus. And for the time I spend in the Senate, it's going to be largely aimed at trying to, like I said earlier, reform the healthcare system, and especially drill down into the particulars of how do we get promising therapies and drugs through the system without that agonizing wait of 12 to 15 years in so many cases.
Senator, thank you so much for all of the work you're doing on behalf of people living with ALS and the people who love them and care for them. A couple of questions have come in, and I wanted to ask you, some of our advocates are asking whether or not the Als Disability Insurance Act, which I think has 61 sponsors or co-sponsors in the Senate, can pass and what they can do to help. Do you have any thoughts on that?
So much of that's the frustrating part of being a Main Street entrepreneur, having my own business for 37 years, where you just had to move more quickly if you were ever going to compete in the real world. And in this case, I don't think there is a good reason why it should not. And I think that you need to get with the 2 agenda makers, Leader McConnell in the Senate and Speaker Pelosi in the House. And I think we, ought to be able to get it through both chambers. And we will be doing our part in terms of trying to get Leader McConnell to get this time either through maybe we can get a unanimous consent vote. The only roadblock that we've had would be, and I'd have to agree with it because we do so many things where we don't have any idea how we're going to pay for it or we're going to find an offset. I'm on the budget committee as well. I can't remember if I mentioned that earlier, but and I think we'll get across that hurdle. So I don't think there are many people, senators that are not going to be for this. Even that's 71, the other 29 that have not weighed in as a co-sponsor, or someone that says that they would not vote for it. So that is really about as close to a slam dunk as you can get in terms of having broad support.
Okay, appreciate that. Now, a lot of people on the webinar here today and those joining us over the next couple of days are going to be calling Congress on June 3rd. What advice do you have to give them about being a successful advocate, and especially now in this virtual domain that we're all living and communicating in?
I think that the more voices that are out there that weigh in, there's really not much substitute. And I hope we get back to being able to, for people to come to DC to make their case. But in the virtual medium, you need to use it like all of us have been and keep the issue out there. I think stress the fact that there are 61 co-sponsors for that particular piece of legislation. Get folks on board with the Promising Pathways Act. That is one that should, now that we've got coronavirus, which look at the amount of attention that's been paid to testing, to therapeutics, and to a vaccine. And the one clear dynamic that is being kind of catapulted across would be the slow movement of anything associated with it. So I think that keep making the point that where we do not have therapies that are out there and available, we need to make sure that we reform the process to make it quicker. And I think as many times as you can repeat it, just keep doing it, because sooner or later it'll break through. And I think we're real close, not only on the particular bills that we're talking about, but I think more broadly in terms of reforming healthcare as well.
Senator Braun, thank you so very much for your time. I know what your schedule must look like today. Really do appreciate all of the work you're doing to represent and empower people living with ALS. You're welcome to stay on the rest of the call if you have to scurry off. I understand that too, but we really do appreciate your time today.
I won't be able to stay on the call, but my office is always open and available for anyone that wants to weigh in. It's got any idea about anything. We've got more momentum going now than I think at any time in the past. So let's keep the momentum going forward. Everybody keep the faith. Once we get back to kind of a regular order, let's do what we've been doing before COVID-19 came along. In the meantime, let your voices be heard.
Thank you, Senator. Have a great day.
Thank you.
Really great to hear from Senator Mike Braun, representing Indiana and all people with ALS. Right now, let's talk a little bit about the association's mission. And for that conversation, I'm going to turn the floor over to Dr. Neil Thacker. Dr. Thacker is the Chief of Mission Strategy at the ALS Association. Welcome, Neil.
Thank you, Morgan, and thank you, Senator Braun, for really exciting talk. So I wanted to talk with you about the mission. If we can go to the next slide. The other direction. Yeah, thank you. The mission of the ALS Association is to discover treatments and a cure for ALS, and to serve, advocate for, and empower people affected by ALS to live their lives to the fullest. So that's a complex sentence, and I break that down into three different concepts. First, who we're serving. So the ALS Association serves people affected by ALS, people, their caregivers, and their family members. And we do this through discovering cures and treatments and empowering people, and this advocacy effort is part of that. And then the what we do, what we're hoping for is to help people live life to the fullest, which is directly from our mission statement, which I define as wellness. So you're as healthy as you can be, that you have both physical and financial security in your life, and that you have a life with meaning. You're able to engage with the community, with your family, with your friends in ways that are important to you. So that's what we're about. And if you go to the next slide, please. Our vision is really a world without ALS. And so that means there are three things that we're trying to do: trying to prevent and cure ALS, trying to help people with ALS live longer, and help people with ALS and their families live better. So what we're doing today is going through the advocacy portion activities of our association. We'll be continuing that and hearing more about care services and research over the next couple of days. And your effort in this fight, I think, are critical for all three of these goals. That's, I think, a good overview of our mission, and I'll turn things back to Morgan to introduce the chair of our advocacy committee.
Sure. Thanks very much, Neil. Before I introduce our next speaker, I do want to remind you that at the end of the program, we'll be taking questions. You can use the chat feature that you should see on either the upper or lower right-hand side of your screen. So feel free to start scrolling them in now, and we'll revert back to them during our Q&A. So onward, I'm really excited to announce Dr. Ken Minkhouse. Ken is a professor of political science at Davidson College in North Carolina, and in this role, he focuses on international and nonprofit issues as well as comparative politics. Prior to his role at Davidson, Ken taught at the American University in Cairo in Egypt, and Ken has served also as a consultant for the United Nations, the World Bank, the US government, and many, many non-governmental organizations also in the private sector. One of Ken's teaching passions is the course Philanthropy and the Nonprofit Sector, which includes a grant-giving exercise requiring students to review grant applications from local nonprofits and disperse $10,000 in grant awards. And joining the board this year, Ken brings vast experience and knowledge of both public policy and the nonprofit sector, as well as his very personal understanding of ALS. Ken, over to you.
Oh, great. I'm unmuted. Thank you so much. And it's good to see everyone virtually today. This meeting is of great importance to me. It was a year ago where I attended the advocacy conference in Washington, D.C. And for me, it was part of a coming out exercise. I had been diagnosed with ALS the year before and kept it to myself and my close family for a year before I realized I was ready. I was ready to do whatever I could, just as you all are, to defeat ALS, whether it was fundraising or advocacy or other roles. And I walked away from last year's meeting so energized by hearing from so many of you and seeing you, getting to know you. I hope you get that same energy from this workshop, even if it's by remote. The importance of advocacy in our struggle is, I think, self-evident. And you're going to hear from our team, our advocacy team, about current priorities, where they stand and what we can do to advance them. But what's key is to remember we are fighting for issues related to coverage, access, research money, and expedited research. All of these are critical needs for people with ALS and their caregivers. What impresses me is that we've really got the special sauce to make this happen. We've got a combination of a small but great team of professionals who know the issues, know how to reach out to other groups, patient advocacy groups, to learn more about priority issues. We've got a very strong public policy committee. The people I'm working with there come from all walks of life with a lot of ideas. And most importantly, we've got you. We bring our voice to the table. It really, really matters when legislators and decision makers hear from us. So it's a great combination, and I think we can do a lot of great things. One of the things that's really struck me over the past few months as I've assumed this role of chair of our public policy committee is how much the landscape has changed by COVID-19. We are now dealing with a much wider range of public health and public policy issues than we were before. And it's both a threat and an opportunity for people with ALS and the organization. We're looking at new issues related to coverage, new issues related to access, fighting to make sure that ALS isn't used as an exclusionary criteria for access to critical care. We've co-signed over 30 different letters and supportive legislation just over the past 2.5 months. I think one of the things that I've learned the most over the past 2 months is the power of coalitions. We have been working with other patient advocacy groups on issues of common interest that have amplified our voice in an enormous way. We're a relatively small group of people with a disease compared to when you combine us with the American Heart Association, the American Lung Association, and the American Association of People with Disabilities, and it goes on and on. That has been a huge tool, really important way to amplify our concerns and advance and protect our interests. So stay tuned. COVID-19 is going to continue to really shape and test our ability to defend and advance the interests of people with ALS. One issue that won't get talked about a lot today, but I want to mention it real quickly since I teach a course on the nonprofit sector and I follow it closely. I'm concerned, as many of you are, no doubt, about the future of many of our nonprofits, smaller ones in particular, ones with tight budgets.
are facing real problems. They can't fundraise if they are event-driven fundraisers. They are looking at decline in contributions because people are strapped for cash right now. And so any legislation that provides support to the nonprofit sector, as the CARES Act did with the payroll protection program, is really critical. And we may be calling on you to write to your representatives to protect and advance that, so the many, many nonprofits that provide care services to people with ALS or advocacy or other or research can survive this crisis. Next slide, please. I wanted to say one thing more before handing the mic over, and that is the Als National Registry. This is a really, really important tool, and one of the things we advocate for continued funding by the U.S. government. It's the only federal agency that is collecting all of the data from us to do risk factors so that we can figure out what causes ALS and hopefully prevent it. We have an ethical obligation not only to pursue cures and treatments for those of us with ALS, but also to serve the next generation, people who haven't been diagnosed yet. And the registry is the place where we're going to crack the code. We need your help. We need your help to advocate for continued support of the registry, and we need your support sending in your information. Please, if you haven't, register with the National ALS Registry. Fill out the forms. It does take some time. They ask lots of questions, but it's our answers that are going to give them the ability eventually to figure out what combination of factors is responsible for ALS. And with that, I'll hand it back to Morgan. Thanks again for participating, and I look forward to seeing you in person as soon as we can.
Thank you, Ken. And a reminder that Ken is also available to answer questions towards the end of our program. So if something that he said or mentioned over the course of his presentation resonates with you or has left you with a question, please use the chat feature and we'll be glad to put it in front of Ken and discuss it at the end of the program. So right now, I'm going to turn our very packed program over to two of my colleagues. Kathleen Sheehan is the Vice President of Public Policy for the ALS Association, and she is here today with Adam Bielowskis, who is our Director of Government Affairs. Team? Okay, Kathleen and Abram. There you are. Okay.
Thanks so much. So glad to join you today. It's just a delight to be you. You can see why we have such passion with the association, with Ken as our public policy chair, and Colin and Neil. It's a terrific opportunity for all of us to work with you and to listen to you and to bring forward what you need with Congress. So I'm honored to do that. And I do look forward to seeing everyone in person as soon as we can. And thank you for being with us today and for your advocacy. Next slide, please. I just want to this is what we're going to be covering in the webinar, and we're going to have some other congressional speakers, so stay tuned. And I think you'll be excited when you hear them speak, as I was listening to Senator Braun. So we're going to talk about our recent accomplishments, just to give you the flavor of what we've been doing. We're going to talk about public policy priorities. As I mentioned, we'll have a couple members of Congress, and then we're going to also talk about how you can call Congress and make a difference. As Senator Braun was saying, your voice makes a big difference. Next slide. So one of the most important ways that the association works on your behalf is to secure federal funding for ALS research. I think most people know that the incidence of ALS in the military is twice that of civilians, and for that reason, one of our top priorities last year was doubling the appropriations for the ALS research at the Department of Defense. Ken spoke very eloquently about the National ALS Registry and Biorepository. In addition to the fact that they focus on risk factors, they have one of the biggest biorepositories that researchers can access in terms of learning more about ALS and sharing that information to find treatments and a cure. We were also engaged last year in protecting, actually this year, the decision was made this year, in protecting access to non-invasive ventilators. That was a critically important thing. We fought for over a year. We worked with physicians, respiratory therapists, and all of you, and thank you so much for the work that you've done. The senator mentioned the Als Disability Insurance Act. We've boosted that up to 61 senators and 237 people in the House, and we're very hopeful that we will be able to get that passed under unanimous consent this year. Next slide, please.
Yes, and thank you, Kathleen. That was fantastic. And seeing that photo of me at the beginning, I clearly need to update my headshot. I don't have hair any longer. So everything we do here at the ALS Association is grounded in our mission, which is to discover treatments and a cure for ALS and to empower people with ALS. And so as you think about our advocacy and policy initiatives, it kind of cascades from there. And so right below that are our advocacy guiding principles that you see here. And below that will be our public policy priorities, which I'll get into in just a moment. And so our first principle is to protect and expand access to healthcare benefits and services. So when you're thinking about this, this is kind of where the Als Disability Insurance Access fits, and all of the work that we do in coalition with American Heart Association, Muscular Dystrophy Association, and others to protect and make sure that protections for pre-existing conditions and the like are preserved in law. And so the next one is to preserve and increase support for ALS research. So the federal government is the largest funder of ALS research in the world, and that's why we are so focused on the federal government ensuring that every year they provide funding for the vital ALS research that's so badly needed. Also fighting for people with ALS on a wide range of issues, a wide range of cost cross-cutting issues, and this includes things like surprise medical billing. There's been a lot that's come up during the COVID pandemic where we've had to respond to a number of things that are both threats and opportunities, as Ken was mentioning, for us to get things passed, like telehealth. There have been a lot of changes to that. And then finally, increased resources and support for families and caregivers of people with ALS. So vital to the work that we do is, of course, trying to end ALS, but also making sure that we're supporting everybody who supports them. And most caregivers are family members. And so it's very important that we focus on also advocating for policies that support those groups as well. Next slide, please. All right, so mission, advocacy guiding principles, and now public policy priorities. These public policy priorities are the specific kind of tactics that we're pursuing to achieve our principles. And the first that we've been advocating for the past 3 Congresses is waiving the 5-month SSDI waiting period for people with ALS. And as you heard from Senator Braun, we're really excited about the opportunity to push this forward now that we've got basically a filibuster-proof amount of supporters. And we'll hear a little bit more about that later. Also, one of the new priorities that we just added within the past month or so is expanding access to home infusion for Medicare beneficiaries. And so one of the 2 therapies that people with ALS can use is Radicava, and so that is a drug that needs to be infused, and we'll discuss a little bit more about that later as well. Also, preserving and increasing federal resources for ALS, and so the primary buckets that we're focused in are the Department of Defense's ALS research program, the National Als Registry at the Centers for Disease Control and Prevention, and the National Institutes of Health. Next slide. And then our last 3 priorities are telehealth. There's been a lot of changes here in relation to the COVID pandemic that are positive, and we'll also be discussing that later, but also the Justice for ALS Veterans Act. And so thinking through that 4th principle, which is expanding supports and resources for family members, this bill would extend some additional resources to the families of veterans who die from ALS. And so very focused in on supporting our veterans with ALS as well. And then finally, advocating for people living with ALS to protect access to care, expand access to drugs and therapies. Next slide. And so the ALS Disability Insurance Access Act, as I mentioned, it's really been one of our top priorities for the past 3 Congresses. And one of the reasons that we're pursuing this is because ALS is so unique. So there's no known cause to the disease. It takes more than 12 months to diagnose, and then the average lifespan after diagnosis is 3 to 5 years. And so there are a lot of pressing issues that make the objectives that we're trying to achieve very pressing. There's also really strong precedent for waiving this 5-month waiting period. In 2000, Congress actually waived the 24-month Medicare waiting period, and so people with ALS should immediately get access to Medicare. However, they still have to wait that 5 months for the SSDI benefits. And so that's kind of like a final barrier to a lot more complete care, and that's why we've been advocating for it. It's an urgent need because most people with ALS will eventually lose their employer-based insurance because they won't be able to work anymore as the disease progresses. And there is very strong support for this bill. We've actually made it past 61 co-sponsors, and as Senator Braun mentioned, an additional 10 have indicated that while they won't co-sponsor it, they will support it if it comes up for a vote. So that brings us up past being filibuster-proof, which really means that if we can get a floor vote on this via regular order, then the bill will pass. And so we are working very hard to do that and continue building support on the House side. And we're really looking forward to seeing whether we can get this for a unanimous consent vote, which is when it's brought up under some different procedures to get it passed without having to go through the cumbersome and long regular order process in order to get it passed more quickly. And so really excited about that. Next slide. Kathleen, I'm going to let you touch on this one.
Thanks so much. So home infusion, as Abram mentioned, very critically important to people living with ALS. Now, if you have private insurance and your doctor has prescribed Radicava for you, you're fine. You're getting your home infusion of Radicava, no problem. The cost of the medication has been covered. The pharmaceutical has been covered. The nursing support is covered. So if you have private insurance or if you're under VA, you will have full coverage of home infusion. However, if you're a Medicare beneficiary, that's not true, and that does not make sense, and it's not fair. If you're a Medicare beneficiary, you can only get coverage for home infusion under Part D. You can receive the drug at home. That's the D is for drug. But you have to pay out of pocket for the nursing care, the pharmaceutical care, and all the other parts of home infusion. Under Medicare Part B, Congress did extend opportunities for people to receive drugs at home, IV drugs, for some drugs under Medicare Part B. They did not extend it for Radicava. And so that's a major problem. So if you are a Medicare beneficiary under Medicare Part B, you can receive home infusion of Radicava, but only if you go to some sort of an infusion center at the hospital, at the doctor's office. That's clearly not acceptable given the COVID crisis. So our goal is to get home infusion covered fully so that people living with ALS who are on Medicare are able to get a Radicava infused at home. Next slide, please.
Thanks, Kathleen. And just kind of a segue off that, this is an issue that really came to the fore on our priorities after we successfully advocated with Congress and the Medicare program to remove ventilators from competitive bidding to allow people to use these devices that they depend on in the home. And so the real goal of a lot of the priorities that we're pursuing right now are trying to be able to keep people with ALS in the home so that they avoid exposure to COVID-19 and making sure that they have the most resources they need possible in order for them to stay safe and in the home. And that's kind of where this home infusion issue also comes from. So moving on to our priorities for research funding, I mentioned earlier, these are our 3 programs. So the ALS research program at the Department of Defense is really one of our top priorities. In 2018, we developed a science-based case for support to increase investment for this program after we did an analysis of the ALS research continuum. And the real hang-up here, the valley of death, if you will, is between preclinical research, so that early phase research, and then early phase 1 and 2 clinical trials. And so based on this understanding, we worked with the Department of Defense and congressional stakeholders to pursue a doubling of funding from 10 to 20 million last year. And now we're pursuing another doubling of funds. And so this program is vital because there is an incidence that's twice that in the military population. People who have served in the military are twice as likely to get ALS, twice as likely. And so it's really a vital program. It's a peer-reviewed program, and so that means that the research that they're doing complements and it doesn't duplicate other areas in the federal government. And so that's really important. So this additional funding that we're going for this year to get to 40 million, so that would be a 20 million increase over last year, is to take the funding and use it specifically for early phase clinical trials. And so that's where the funding is, if anybody asks, is that we're trying to expand the focus of the program. Next is the National Als Registry at the CDC, and this is a really vital program because it actually funds its own research and its environmental risk factor research. And so there's no other agency out there that's really doing this. And if there's any agency that's going to find out what causes ALS, it's going to be the National Als Registry. It also collects biological samples and specimens through its biorepository, and so it's a real center of resources for researchers across the country, and it's just fantastic like that. The next is the National Institutes of Health, and so that is the largest funder of ALS research in the world, the largest public funder, and this year we're going for 44.7 billion. So we work very closely with a coalition of other leading nonprofits every year to ask for a top line funding amount because the National Institutes of Health spreads its money out amongst the institutes and it trickles down. So last year, the NIH actually provided 105 million for people with ALS, and so it's really the biggest funder out there, and we're always going to be supportive of it. Next slide.
So thanks, Abram, so much. That's really helpful in terms of the overview. So telehealth, clearly everyone on this webinar knows the importance of being able to receive a conference call or a phone call from your physician during this time when no one wants to go to any sort of a group setting. So we've worked very closely with other groups to push through changes both with Congress and with the administration to make telehealth a reality. And that's been an important priority for us. So now there's opportunities to have consultations by interactive video, but you can also get them by phone. You can talk to your physician, you can talk to a nurse, you can talk to a therapist. All those these are new changes, and our goal, of course, will be to fight to hold on to those after the COVID crisis. And we're working across the board with people to do that. One of the things that we do that's so important is that we look specifically for things that are going to impact people living with ALS, and we pull them out and we say, these are the most important things, and we take on the campaign to get them fixed. And recently our ALS clinic, one of our ALS clinics called us and said, I'm really upset we're not able to get telehealth for speech generating devices or for being able to diagnose swallowing issues and providing help to people. And that must happen. And based on that phone call, we went to action immediately, called the American Speech Hearing and Language Association, had a joint phone call with them, and we've made a direct appeal to the Medicare program to cover those things. So that's the way that we help you, not only in terms of the broad picture, but in things that are ALS specific that will really make a difference in your life. And we expect that Congress, that CMS, will cover those procedures, but someone has to ask, and that's our job. Next slide, please.
Okay, we're going to take a quick pause right here. It looks like one of our other special panelists may have just joined, so I'm going to turn things over to Morgan really quick.
Congressman, are you with us?
Can you hear me now?
We sure can. Thank you and welcome.
I'm sorry. Hey, welcome. I wish we were all together meeting in my office and you were having your wonderful fly-in that is really so important for the advocacy work that you are doing on such a sustained basis. But thank you for continuing your effort and your advocacy on behalf of folks with ALS. It really, really makes a difference day in and day out when you're doing the advocacy that you're doing, trying to get the policies that you need and the people that you very much love need, it can always seem like an uphill battle, and it frequently is. Congress is a tough institution to move, but it's when you kind of look back a little bit, step back, and you realize, oh my goodness, you know, the non-invasive ventilators, that was really something that you laid the foundation for with your long-term advocacy, and it has paid off significantly. We've got to continue on the ALS Disability Insurance Act. And you know what? We've got 238 sponsors, co-sponsors, as you know. If we hit 290 co-sponsors, then we're going to be able to put that on the consent calendar. So even though everyone's focused on COVID, let's push that and try to get to 290 so that we have an opportunity to bring it up on the consent calendar. And also, even as terrible as COVID is, the respiratory illnesses that are associated with COVID are no stranger to the ALS community. The respiratory function for a person with ALS is severely compromised. And I see that this situation with COVID is broadening the awareness about respiratory, the respiratory issues that people face, particularly folks with ALS. So, you know, we have been doing things that make, I think, a difference, even in the COVID legislation that will be beneficial to the folks that you are working so hard for. The requirement for a special enrollment period for the ACA, you know, additional Medicaid funding, and maintenance of effort provisions in the legislation. We want to have Medicaid expanded, but we don't want that money that goes to the states to then be diverted into other uses instead of the state doing its share. So we've got to maintain that maintenance of effort. The fact that we were pushing so hard to have no cost sharing for COVID testing or treatment or for the cost of the vaccine, regardless of the insurance status, that's fundamentally important, I believe. No one of us is responsible for COVID. I mean, this is a pandemic, and we haven't had one like this in our country, thank goodness, for 102 years. 2018, of course, or 1918 was the last time we had a big pandemic, and that was the Spanish flu. And we lost 600 lives at a time when our population was 1/3 of what it is today. So this is really, really significant. And in our legislation, we're expanding access to home health care and very significantly expanding access to telehealth for home health workers and occupational and speech therapists. And I think that has broad benefits that are helpful to the ALS community as well as many others. So it's been, for me, a labor of love to work with you and to be an advocate on behalf of the issues that concern the ALS community. I really, really appreciate it. Every once in a while in Congress, I'm not saying it's that often, but every once in a while you get a chance to do something useful. And working with you, you give me many opportunities to do that. And the non-invasive ventilators is something that I'm so pleased to have been associated with. And I want to say thank you to all of you, and keep up your advocacy. It really, really matters. And these personal interactions that you have with members of Congress really makes an impression. So I'll stop there. I don't know if there's any questions or comments, but once again, thank you for all that you're doing. And it's wonderful to meet you even under this virtual meeting instead of our in-face, far preferable meeting.
Thank you very much, Congressman. And there are a couple of comments. A lot of people are thanking you sincerely for your work on the SMART Act. That mattered to an awful lot of people, and they're expressing a lot of gratitude right now. You briefly mentioned this, and a couple of questions have come in regarding COVID taking out all the oxygen in the room, in the Congress and in the Senate. Can you talk about how other diseases and other legislative priorities are being weighted and heard in the midst of a global pandemic?
Well, what I said is true. You know, that COVID, look, we did something astonishing. We'll step back for a second. On January 19th, we had our first case in the US that was documented. That was the same day in South Korea they had their same case. We've had 100,000 deaths. Many people think it's higher than that. South Korea's had a fraction of that. What's the difference? The difference was that they had a public health system that responded to the pandemic immediately, while we didn't. And having a public health system that responds with alacrity is something that we need, whether the particular illness we have is ALS or it's diabetes or any other thing that affects the American people. And I think one of the things that's happened in this COVID crisis is that it's exposed some of the weaknesses that we have in our public health system. And you know, South Korea, they did social distancing right away. They did expensive testing. They had a public health court that did contact tracing, and they did isolation. We did none of that. But what is happening here is more and more members of Congress, and I think more and more Americans, are asking themselves about why we don't have a better healthcare system that is able to respond, in this case, to the emergency epidemic of COVID, but why in general, if you have a condition, you can't have confidence that the healthcare that you need will be there. So ALS, obviously, or diabetes, I'm not comparing the diseases, but I'm saying that, do we want to have a healthcare system that's going to meet the needs, whatever those needs are, or do we want to have a constant battle to try to get proper attention paid to the particular illness that's afflicted a family member or someone we love, and that we're involved in assistance and promotion of response to that illness because we're personally affected, when in fact we also know that, well, we may know or love a person with ALS, there are other people with different conditions that have ones who love them as well. And I'm seeing an upsurge in interest in trying to strengthen that healthcare system that would be available to everybody, regardless of illness. Now, with ALS, where relatively speaking, not as many people are affected, you have this incredible challenge of bringing attention, proper attention, to this very fierce illness. And I see us as getting allies when more and more people are aligned with the goal of having a healthcare system that is going to be there for all Americans when they need it. Thank you.
Hey, thank you. Thank you so much. One last question, and I'm asking this of all of the representatives who are joining us here today. On June 3rd, people living with ALS from all over the country are going to be calling the Hill. Can you give us any advice in this environment we're in on how to be an effective advocate?
Well, I can. I think the most important thing to be an effective advocate is to be specific in what you're asking the member of Congress to do. So it's, quote, the ask. You know, you'll meet with members, and I think they'll generally be quite sympathetic, Republican or Democrat. And you'll have probably a story or two about a particular case that is extremely compelling. But when you walk out the door of visiting my office or another member's office, the question you want is, what do you want me to do? What legislation do you want me to support? What funding do you want me to support? So I think being very concrete in what your, quote, ask is, because what ultimately a member of Congress can do or not do is support a specific measure that advances your agenda. And that means you want the meeting to be more than just a sit down in an exchange of heartfelt discussion. You want to move ahead. So you want funding, you want the SMART Act support, so the most important thing I can say is when you go in, you have a concrete ask and try to get an answer from the member of Congress before you leave, or an assurance from the member that they will review it and give you an answer.
Very good, thank you. And one last question, Congressman, what is your affinity to ALS? How did you become as involved as you are in this particular?
Some wonderful Vermonters approached me, a number of years ago, and one of the wonderful opportunities that a person who has my job has is that people you represent will approach you and tell you their story about a family member who has ALS, and you'll see how much they are affected by it. You'll see how much love and determination they have. You'll see how they have taken what is a lot of heartbreak in their family and channel it into constructive, positive energy. So over the years, I've met many families from Vermont, and they have had a loved one with ALS. And I have this blessing of being able to say, I want to help, so that's the origin of my involvement. So I thank all of you for being the advocates you are.
Thank you very much. And as we speak, even more accolades are coming in for your support of the SMART Act. So thank you very much. Much appreciated. We do appreciate your time, and you're welcome to stick around. And if you have to go, then we'll bid you farewell. And thank you very, very much again.
Yeah, thank you very much. And I'll say goodbye and good luck. Bye-bye.
Thank you. Bye, Congressman.
Yeah.
Okay. So we took a quick diversion to accommodate Congressman Welch and his schedule, but I think at this point I'm not going to do that. We've been joined by our next special guest speaker. Representative Jason Crowe is here, and Representative Crowe represents Central Colorado, including Aurora and portions of Denver. He's a founding co-chair of the House Als Caucus, and working with the ALS Association, he led a Dear Colleague letter signed by 178 of his colleagues requesting $40 million for the ALS research program at the Department of Defense and $10 million for the ALS National Registry. So welcome to you, Congressman Crowe. Really glad you could be with us here today. We just want to check and make sure you're unmuted. Can't hear you right now.
Okay, can you hear me now?
Now we can, thanks.
Okay.
Welcome.
Thank you. Thanks, Morgan. Thanks for the introduction. Thank you. Should I share my webcam as well? How are you doing this?
Any way you like. We would love to have you on webcam.
Okay, great. Can you all see me?
We can.
Okay, good. All right. Well, we're working out the technology one step at a time here. So good to see you all. Morgan, thank you for the introduction. Thank you to the ALS Association for the invitation to join you all. My name is Jason Crowe. I'm a first-term member from Colorado's 6th Congressional District, so took office in January of 2019. It's been about 18 months going on 19 years in office is what it's felt like the last year and a half, so a wild first term to be sure. This is my first time actually in elected office, let alone in Congress. I was a lawyer in Colorado for almost a decade before this, and a veterans advocate in the state. Before that, I was an Army Ranger and served multiple combat tours in Iraq and Afghanistan. So I've been doing a lot of stuff for veterans and their families since leaving the service. The issue of ALS is very close to us. My wife's cousin, who she was close to, her and her family, passed away from ALS several years ago, leaving a young family behind. And in addition to that, we also know that veterans are several times more likely to have ALS the general population as well. So something that we've seen in the community quite often, and something that we have dedicated ourselves to helping to combat. So that's why I joined with some colleagues of mine when we first came into office to form the Als Caucus in June of 2019, along with Brian Fitzpatrick, Terry Sewell, and Ken Calvert, bipartisan caucus. Also, in the first couple of months of my time in Congress, I was visited by Nicole Simbora and her daughter, who told me the story of Nicole's husband, Mike Simbora, who's a constituent of mine. And Mike passed away about a month after that visit. And I've gotten to know them and their family over this time. So it's something that, again, we have a very close personal connection to. So the Als Caucus that we formed brings together people from across the aisle. It's a bipartisan caucus, and it's gone from just this small group of founding members to over 130 members today. So I think that shows the extent to which this issue touches on so many lives and so many members of Congress and our elected leaders throughout the country. We have taken a number of action, including a resolution to make May ALS Awareness Month, which was joined by over 73 of our colleagues, bipartisan colleagues in Congress, to help us raise awareness for this as we fight for a cure. And also, as you mentioned in the beginning, we've called for more funding for ALS research, including $45 million for National Institutes of Health to improve the treatments to find a cure, but also NIH, as many of you in this call know, tackles some of the riskier, more expensive investments that sometimes in the private sector, some of the companies are reluctant to make. So it's really important that we continue to drive funding at the NIH level. I mentioned at the beginning the impact of ALS on veterans. We know that they're over 2 times more likely to develop ALS regardless of the branch they served in. So that's why DoD has really taken a lead in fighting for more funding, and again, on some of the earlier stage research and development as well. So I worked with Mike Gallagher, as you mentioned, to push for $40 million for that research funding in the next NDAA for 2021. So we're going to continue to fight hard for that, Mike and I, as well as other members of the ALS Caucus, and $10 million for the National Als Registry to continue to collect data on ALS patients across the country, because we have to really fully understand who it is that's contracting ALS to drive that research. Finally, I'll just say for the HEROES Act, the HEROES Act is really important because it is really a lifeline to folks not only in the ALS community, but across the country who are very vulnerable, to provide some of the direct immediate relief that the community really needs right now to help support them and their families. So we're going to continue to fight hard for the HEROES Act as well, and urge the Senate to take this life-saving bill up. So thank you again to the ALS Association and to all people on the call. I will give a special shout out to the Rocky Mountain chapter of the ALS Association, the great things they do for Colorado, Wyoming, and Utah. So thank you so much for your leadership and your hard work, and just know that you have a friend and an ally in Congress, along with all the other folks that you've heard from today as well. So thank you so much, and thank you again for the invitation to join you today.
Very much appreciate your time, Congressman. Thank you.
Thank you.
Okay, so now we are going to skip back to the program. I want to thank you. We have a lot of questions rolling in. Keep them coming. We will do Q&A at the end of the program. There are quite a few. We're going to get to as many as we possibly can. So at this point, I am going to turn the table back to, Abram and Kathleen, to see if we can finish the discussion on justice for ALS veterans. And I see that slide is up. So Kathleen and Abram, you can take it away. Thank you.
Great, thank you, and hope you all enjoyed some of our special guest speakers. We were really excited to bring them to you today. Stepping back to our policy priorities, and timely mentioning that Congressman Crowe is actually a veteran himself. So people with ALS are up to twice as likely to be diagnosed with ALS. And in the mid-2000s, the Veterans Administration actually recognized ALS as a service-connected disability. And so when people with ALS that are veterans develop the disease, it's automatically accepted that it was the result of their military service, and it opens them up to be eligible for additional benefits called dependency and indemnity compensation, among others. And so we are fighting with Congressman in the House and the Senate to pass the Justice for ALS Veterans Act, which would provide just a couple $100 of additional resources to families of veterans who die from ALS. And so currently, people with ALS who have served in the military that get the disease are eligible. Their spouse is eligible for about $1,300 once their loved one passes from the disease. However, there's an additional $280-ish per month that's called a kicker that people with disabilities, if they've had their disease for 8 years after serving, are additional for that extra kicker. And that's what we're fighting for ALS. And so this bill is really about fairness. The ALS families shouldn't be denied the same disability and indemnity compensation as other disabilities. And so we're fighting for this because people with ALS, they often don't live 8 years to actually be eligible for that extra added benefit. And so that's what we're fighting for, that extra $280 kicker. And so, like I mentioned, the precedent for this happening is that the Veterans Administration really recognized ALS as service-connected in 2008. Next slide. Kathleen?
Hi, thanks so much, Abram, and it was terrific to hear from the members of Congress, and to I hope everybody on the webinar knows how much support you have and what a big difference you make in terms of advocating with members of Congress. We really miss seeing you because one of the great parts of having you all come to Washington, D.C. is being able to join you in some of your Hill visits and listen to the wonderful stories that you tell about your lives and your courage, and how everyone speaks out for other people in terms of asking for what's needed. As was mentioned early on by Ken and mentioned throughout the presentation, there's a lot going on. Representative Crowe just mentioned the HEROES legislation. That's a bill that's in the House side that has not yet been taken up on the Senate side that would provide additional resources for COVID. It's another one of several COVID pieces of legislation that Congress is considering. And there's some things in there that are important to us, and we're going to continue to work to get that legislation passed. As you all know, anyone who's been around for a while, pre-existing conditions are really critically important in terms of legislation, in terms of health insurance. So before the Affordable Care Act, it was very difficult with someone who had a pre-existing condition to get coverage. You had to wait. Sometimes you had to pay more money, and it just left people feeling very, very vulnerable, whether it's for yourself or it's a family member. Having that pre-existing condition was a barrier to getting immediate access to health care. That's one thing that we continue to fight for. There are now protections in place that basically say that insurance companies are not able to discriminate against you if you have a pre-existing condition. That's critically important for anyone living with ALS because it takes a long time to diagnosis, and you want to be sure that when you walk into the doctor's office that you can get coverage for everything that you need. So that continues to be very important. There's a lot of barriers in terms of medications. Many of you know that some medications you can only get for 30 days. Some medications you have to go through a couple of levels of authorization. Your physician sometimes has to get on the phone and fight for you and say they need this medication. Our goal is to take away all those barriers so that you can get the medications that you need paid for by your insurance company and get access to them. Especially important now during COVID, when you want to be able to get a 90-day supply of medication and get what you need. And that ties back into home infusion. You want to be able to get that medication at home. And then clinical trials, I think everyone knows, and we're going to have a terrific webinar tomorrow on research. And by the way, the day after that will be care services. Research is a top priority for the association, and we are highly committed to clinical trials in terms of speeding access to effective treatments through efficient, impactful, and respectful clinical trials. The association has done a lot of work in this area, and you'll hear about it tomorrow in our research webinar. Next slide. We have many partners, and our partners, of course, are our ALS clinics. We work with them when you go in and talk with your clinic staff about things that are bothering you. That comes back to us. We work with the Muscular Dystrophy Association, IMALS, Team Gleason, Les Turner. So all of the organizations that are in the ALS space, whether they're working on advocacy or research or care services, we have connections to them and we view them all as our partners. We have a great partnership with the American Academy of Neurology, and that's a partnership that we really initiated. We went to the American Academy of Neurology and said, you really need to have a patient advocacy group working with you. They agreed and they started one, and most recently, and this is how these things work, we went to the American Academy of Neurology and said, hey, we think it's really important that you send a letter to Congress, and we have some things that are really important to us that we want to get included in your letter, because members of Congress do tend to listen to physicians. So whenever we can reach out and engage physicians, nurses, other healthcare professionals, that's what we want to do. So we have a terrific partnership with your neurologist. All the neurologists belong to the American Academy of Neurology. Ken mentioned a little earlier that we work very closely with other national associations, the big players, and we do that through the partnership to protect coverage. So we regularly get a stream of information, kind of behind the scenes information, who's saying what bill is going to be introduced. And then we also participate in what's called sign-on letters. So if an issue comes up and patient advocacy groups feel that it's really important, we get together and work on that. So one example would be smart billing, surprise billing, excuse me, where you might go to a hospital and you might be in network and you come home and you find out that you've got a surprise bill. We don't think that's fair. We don't think that's appropriate. We think that all the billing should be centralized to the hospital, and you shouldn't be receiving a bill from anyone else at the hospital in terms of people who might have provided services to you but weren't affiliated with the hospital. We work very closely with the National Health Council, and again, Ken mentioned that being sure that there is funding for nonprofit organizations, for your chapters, and for organizations that provide research funding, such as we do, philanthropic research. That's very important, and we work with a National Health Council on that. We also work with the National Organization for Rare Disorders. I actually just got off a webinar that they had a few moments ago, and we work in collaboration with them on a wide range of issues impacting people that have a rare disorder. Next slide. Ashley, I'm going to turn it over to you at this point.
Great. Thank you so much, Kathleen. And I'm going to go through, we've talked a bit about our advocacy efforts here at the ALS Association. I'm going to talk through our Call Congress Day that's coming up on June 3rd, which we're really excited to be hosting this year, and also our virtual advocacy throughout the year. So while we can't travel and all be together in Washington, D.C. as much as we would hope so, as you've heard from our congressional speakers today, Congress is still working. They're still doing their jobs at home, and we can still make an impact in the fight against ALS. On June 3rd, the ALS Association is hosting a Call Congress Day to ensure that the voices of ALS advocates like you can be heard in support of our policy priorities. Over the next few slides, I'll give you a sneak peek of what you'll see during our Call Congress Day on June 3rd. Can we go to the next slide? On the morning of June 3rd, everyone registered for the virtual advocacy conference, all of you. So thank you for joining and for registering for our exciting 3 days of the conference. We'll receive an email from the ALS Association that morning of June 3rd. You'll simply click the link in an email and it'll take you directly to our Advocacy Action Center. There, you'll have a chance to review the call script, which you can see a preview of on your screen. And have the opportunity to review it and personalize it for yourself, talk about the impact that ALS has had on your life, and that you can share with your members of Congress and their staff. It's a short script and follows the guidelines that we've heard throughout today, making our ask clearly and succinctly in 5 points. So you'll have that opportunity to review your call script before you even make a phone call. Then once you're ready to make your call on June 3rd, you simply click the button at the bottom and our Advocacy Action Center calls you. So when you registered, you provided a cell phone number. We'll use that number and the system will call you and connect you directly to both of your senators and to your member of Congress. Next slide. After you make all of your phone calls, so you'll make your phone calls to your first senator. Once you hang up, please provide us with how the call went, a couple of anecdotes about the call and who you may have talked to. We've heard from congressional offices and staff. While everyone is working, they may be working from home. And so calls may be forwarded to staff working from home. So please share how your call went. Let us know if the member of Congress is supportive of our ask. And for our June 3rd Call Congress Day, we're focusing on our Social Security Disability Insurance ask. So asking Congress to pass the ALS Disability Insurance Act. We've heard throughout today's webinar how much support we have in Congress. So this should be a good thing, a beneficial ask to make sure that we continue the momentum of all of the great support that we have with members of Congress who've yet to support our ask. So we'll be focusing on that ask on June 3rd. Once you provided your feedback, you simply submit and continue and make the rest of your calls. So on June 3rd, you'll be making 3 calls, 2 calls to your senator and 1 to your member of Congress that day. Once you've reported back and finished all your calls, please, we'll have a social share option on our Advocacy Action Center related to this action. Please share it on social media, on Twitter and Facebook with your friends and family. It's a really great way to amplify our advocacy work and ask other members of our communities to join us in our fight. Next slide. As we've heard throughout today, Congress is continuing to work, so we'll continue to advocate. Our Call Congress Day is an opportunity for us to make a big splash to urge Congress to act on behalf of our community. But the ALS Association engages and activates ALS advocates like you throughout the year in support of our policy priorities. By attending this conference, you'll be automatically registered in our Action Center if you haven't been already. And you can visit that at any time at alsa.org/advocacy. Next slide. And on our Call Congress Day and throughout our advocacy throughout the year, I wanted to make sure that everyone know how important your advocacy, the advocacy of our ALS advocates and your as a constituent for your community, how impactful those phone calls and those letters and those emails are to helping Congress make decisions in support of our community. This is an example from earlier this year. We've heard about the SMART Act and access to non-invasive ventilators, how we've been fighting for that over the last year. We had an ALS advocate out of Illinois complete our action in our Advocacy Action Center, sending a letter to Congressman Rodney Davis. As a part of that action in our Action Center, that constituent had the opportunity to send a tweet to their member of Congress. So they took a private action, sending an email through our system, and then a more public action, urging that member of Congress to support and co-sponsor that bill that we were supporting for non-invasive ventilation. As you can see, the congressman saw that tweet from that constituent, thanks them for their time and for bringing that bill to their attention. And it's a really great way to publicly pressure and persuade our members of Congress to act in support of our communities. So it was really great to see that interaction between a constituent and a member of Congress in that public forum on Twitter. And a couple of days later, this happened in February, a couple of days later, we did see that Congressman Davis ended up co-sponsoring the bill and supporting this legislation. So You saw the full circle of advocacy, from the advocate taking action to the member of Congress doing the action that we requested. So it's a really great example of our virtual and online advocacy efforts that we've done pre this COVID-19 pandemic. We've been engaged as an association in virtual and online advocacy for a number of years. So we're continuing to do this great work throughout the year in this pandemic and beyond. And with that, we can go to our next slide.
Okay, I believe Tom Cotton is joining us shortly, but I'm not aware that he is here yet. So I think we can just go right to some of the questions that we've been receiving. Give my team online a moment to prepare and unmute their microphones for questions. Oh, okay, I am wrong. We are ready to go to Mr. Cotton. So I'm going to let my colleagues take it away. I believe that we're going to go to a video. Just by way of background, Senator Cotton represents Arkansas in the Senate, and Senator Cotton has also been a great champion of the ALS community for years, and most notably as the Republican champion co-sponsor of the Als Disability Insurance Act, S578, which he's currently fighting to have passed through the Senate. He can't be with us in person today, but he has provided the following video, which will wrap up this webinar, and we will take your questions right after that.
Hi, I'm Senator Tom Cotton. I want to extend a warm greeting to all my friends who are attending the National ALS Advocacy Virtual Conference. We're going through some difficult times as a country, so I'm heartened to see that the ALS Association and all of you are still working hard to raise awareness about ALS. Rest assured, we're working hard here in Congress to address the problems and challenges that your advocates have raised. I know from talking to Arkansans and members of your group just how difficult this disease can be. Sadly, an advocate from Arkansas who many of us knew, Kipling Anthony Jackson, passed away just recently. But the lives of advocates like Kip also show how cheerfully they fight the disease and live their lives, despite all the challenges and struggles. That's why I'm proud to be a founding member of the Als Caucus in the Senate, which is dedicated to breaking through partisan gridlock in Washington to pass legislation that will help people living with ALS and their families. Legislation like the Als Disability Insurance Act, which would waive some burdensome waiting periods that ALS patients face in order to receive Social Security disability benefits. This bill would help alleviate some of the financial hardship that families incur with an ALS diagnosis, so they can focus on what really matters, their love for each other and getting the best medical care possible, without worrying whether they will receive their benefits. I'll fight with you to get this bill passed into law, but when we do, our work won't be over. It's our job to support everyone living with ALS in Arkansas and around the country, which is why I'm grateful for advocates like you and hope your virtual conference is a big hit. Thank you all, and God bless.
Okay, great couple of words from Senator Cotton. And as promised, we can take a few questions right now. I'm going to start and pose one that just came in to Kathleen or Ashley. Will everyone who is registered as an ALS advocate, or just those registered for the advocacy conference, receive the link for Call Congress Day? Can you just clarify where that link is coming from and who it goes to?
Yeah, thank you, Morgan. I'll take that. This is Ashley again. Everyone who is registered for the virtual advocacy conference, as well as anyone who is registered in the Advocacy Action Center, will receive the email on June 3rd. So our entire community will be able to take part in our Call Congress Day on June 3rd.
Okay, Ashley, another question for you. People who have lost the ability to speak due to ALS, what is the recommended communication strategy for them on Call Congress Day? Okay. Ashley, are you here?
I am. Kathleen, did you want to take that question? I'm happy to answer it, but I know you just unmuted
Yeah,
yourself.
absolutely. So it's really important, and thank you so much for asking. First of all, if you have a family member with you, we would encourage you to ask that family member to make this kind of ask. Secondly, we will be happy to set up a phone call with you and the member of Congress. You have to have certain technology to do that. So if for any reason you are not able to make that phone call, please let us know, and we'll work with you to make it happen. Members of Congress, as we've seen, are working from home, and so therefore it's difficult for them. They may not have the right technology. So we're going to have to put a little bit extra effort in to make it happen, and we're happy to do so, and we'll make that happen.
Thanks, Kathleen and Ashley. Quite a few questions coming in about Medigap and Medicare Advantage programs. The questioners are looking for some clarification. The Medigap policies are allowed to discriminate against people who qualify for Medicare for reasons other than their age. Is this on our radar in terms of public policy?
Yeah, so thanks for asking that question. So Medigap are private plans that someone purchases on their own to supplement Medicare. So Medicare does have a lot of co-payments and deductibles, and the Medigap programs are private insurance programs, and that's how they operate. So we are aware that there have been some problems with the Medigap programs, and because they're private plans, we have to work with them individually. So if there's someone that's having a problem with their Medigap program, if they'll send us an email, we will look into it and see what we can do to help you with that. Now, there's another program, Medicare Advantage programs, which could have been also what someone was referring to. Those again are Medicare programs that are you purchase it instead of getting traditional Medicare. And if anyone has any problems with either Medigap, which is the wraparound, or the supplemental coverage that pays for your co-pays and deductibles and things like that, please let us know, and we will do what we can to help you with that. We have the ability to call upon a couple of different advocacy organizations that have lots of attorneys that are very experienced in this, and we will help you find the right attorney that can help you figure that out.
Terrific, Kathleen. Thanks for that. I do want to just point out that there have been quite a few questions and requests for access to this webinar after the fact. We will be posting the recording. So that will be on our advocacy page on our website. So yes, you will have access to re-listen to any of the questions or presentations at your leisure. I can't tell you exactly when this will go up. As soon as we get the recording process, we'll move with alacrity to make that done. I get that done. A couple of other questions, and I'm kind of skipping around here because I was just sort of writing them down as they came in, so no particular order. But some questions about potential legislation that may or may not be on our radar screen. Somebody has asked if there is any legislation or thoughts of legislation that would assist with travel costs for people with ALS that need to travel to clinical trials, because that alone, those costs can be a non-starter for somebody's participation. Anything about that, Kathleen or Abram, that you can address?
Let me just say I'm not aware of legislation, but I know it's a high priority for us whenever we're working with a clinical trial to be sure that they know how important it is to provide transportation and support for those kinds of things. I might turn this over to our research folks tomorrow and have them answer this question when they've had a chance to do a little bit more research. But at this point, there is not legislation that would pay for travel costs. Yeah, we are very concerned and we want to be helpful to you. And if you let us know the challenges that you face, we'll do everything we can to help you.
Okay, great.
Abram,
And Kathleen?
I would just say that while that particular issue isn't something that we've been aware of in terms of legislation, we are working with Muscular Dystrophy Association, Paralyzed Veterans of America, and other groups to increase accessibility itself to flights and the like, and just being able to make sure that we're addressing and being able to provide the right amount of space for the equipment and everything that's needed to travel for folks with ALS, and just overall accessibility to planes.
Okay, thanks, guys, and stay right where you are. I have another one. What specifically is in the in the HEROES Act that pertains specifically to ALS? A few people are asking for clarification on that.
Yeah, there's a lot of different pieces in the HEROES Act, and they're all moving pieces. It certainly provides support to continue some of the payroll protection. It provides the most important thing, I think, for people living with ALS is it has some telehealth provisions that would expand. We will work to get an alert out to folks. It is a moving target, so we will provide more information on that. It's a very big bill. I don't know how many pages, several hundred pages. So we will check into that and get out information to you all.
Okay. And I have a question about the status of HR 2408. That's the Ensuring Access to Quality Complex Rehabilitation Technology Act. Are there any updates on that particular piece of legislation?
So I believe that this question is referring to creating a separate benefit for complex rehab technology, and we're working with a number of different coalitions, and we're on the steering committee of the ITEM coalition, which works on all of the durable medical equipment issues at the Centers for Medicare and Medicaid Services. And so that's definitely a bill that we're focused on. At this point, it is currently trying to be wrapped into any kind of COVID-specific legislation that's moving. But it is an issue that we've been working on for some time, and it is a costly issue. And so given this time of all the issues that we're dealing with the pandemic, this is definitely one of the issues that we're trying to see included and working actively to do.
Okay. We have a question about the caucuses. Of course, we have a House caucus and a Senate caucus for ALS. And there's a question about how they work. What is the caucus? What is their work? And how do they work for our advantage as a community?
I can take that. So I think you heard the great level of enthusiasm that every single member of Congress mentioned when they mentioned the caucus. It really is an opportunity for members of Congress to work together on an issue that they're very passionate about. A caucus is not a legislative body. They can't make legislation, they can't pass legislation, they can't add in funding. So it is really basically, I would say, a network of people living with members of Congress who care very much about ALS. I would say to this, as important as the caucuses are, we also believe that it's also really important that every member of Congress who joins one of our Dear Colleague letters is really a member of someone who supports our community. So sometimes a member of Congress will not join a caucus for one reason or another, but when appropriations time comes around, they put their signature on the Dear Colleague letter. And that signature, that's legislation. That makes a difference. And we've had a tremendous amount of success in involving members of Congress and the House and the Senate in signing on to Dear Colleague letters. So there's a number of different ways that members of Congress work together. A caucus is an educational networking body that brings people together. And then our Dear Colleagues are really legislative in nature, because once you put your name down on a letter and you stand behind it, that really makes a big difference. So they're both important and they both have a lot of value.
Okay, and I can see that we are already 6 minutes past the bottom of the hour. I'm going to squeeze in one more question, and this is a good segue. This is not specifically an advocacy question, but we do have an awful lot of people in our audience who are asking this. I will remind you that we could take a lot of research questions tomorrow on our research webinar. So we can get to a lot of those questions that were posed about research in the next webinar. But this one I'm going to toss to Neil because it's come up so frequently. People are asking about the status of clinical trials and funding for clinical trials during COVID. Can you give a brief status update on what we're hearing about the different trials going on across the country and whether or not they've been paused or if they're ongoing during COVID-19?
Yeah, thank you. And we will talk about this more tomorrow. I think Dr. Benatar is running some of those trials and he'll be able to speak to that directly. But in general, clinical trials have been delayed a little bit depending on their phase that they're in. And so it's very difficult right now to recruit people into clinical trials if it's hard for people to get into a clinic or a facility. So that's been a challenge. Once people are in clinical trials, I know the trials are working hard to collect what data they can remotely or by telemedicine or telehealth. And so they're modifying their protocols to keep collecting information. So that's the general gist of it. There have been some COVID impacts, and but I know everyone is doing their best to keep moving forward. The funding for clinical trials that's happening in the private sector and the government sector so far is still flowing, and I think for research organizations the voluntary research organizations are also having to worry about the challenges that they're facing because of the impacts to the economy.
Okay, fair enough. And again, more on that tomorrow, most likely with our guest, Dr. Benatar. So we're going to call this a wrap. I'm going to turn it over to Kelly to say final farewell to all of you. Don't forget, 3 o'clock tomorrow, our advocacy webinar on research. Kelly?
Yeah, great. Thank you, Morgan, and thank you, everyone. I hope you enjoyed the conversations today. Really, really great information. I want to thank all of our speakers, both our staff as well as members of Congress that joined us. And a big thanks to our sponsors once again. I'm looking forward to tomorrow's conversation around research. I hope you are too. And while I certainly do miss seeing everybody and being together for this wonderful event, I'm glad we're at least able to come together virtually. So have a great rest of your day, and we look forward to virtually seeing you again tomorrow. Take care.